What's going on, everyone? Happy Saturday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, March 30th, 2024. If you're new to my channel, this is where we do the daily Pandemic Update on all things COVID and any other virus that could be a health threat to you. So if you want to stay informed, subscribe to my channel down below. If you want to keep other people informed, by all means, share these videos with anyone you know. Give this a thumbs up if you like the content, and leave a comment down below. I know, we're behind on responding to comments. I promise I will try and catch up on the comments this weekend. Quick side note. Last night, speaking of testing positive for COVID, I did not test positive for COVID yet, but I did take a COVID test just to be sure. You may notice my voice is a little messed up. I tend to get allergy season. It tends to hit me very hard each year, and this is something that has started before long COVID. Maybe it's worse now because of long COVID. I've been taking my allergy medicine, Allegra, which my doctor has me take, and it's working for everything except my voice. I'm sure you can hear it clear as day. It's the best I can do today. My voice is just a little out of it. I've had a scratchy, sore throat feeling since Thursday. Today's about the worst it's been. Similar to yesterday, but I would say today's about the worst it's been. I'll continue testing for COVID. Hopefully it continues to come up negative. But hey, we have to do a pandemic update today because there's quite a bit of things to talk about. Worst case, we may skip out on tomorrow to give my voice a rest. Alrighty, starting off today. Avian flu is found in Michigan cattle. We already knew that it was found in Texas, New Mexico, and yes, Idaho as of recently as well. And this just started back around the 17th, and then the first cow got sick in Texas on March 20th. So, yes, it is spreading, and now it is being found in Michigan. Moving on now to our next story. Check this out. U.S. TB cases reach highest level in a decade. That's right. Tuberculosis cases in the United States are rising. And it says in 2023, let's find it here. Yep, looks like there were more than 9,600 cases of it in the United States, which is a 16% increase from 2022. All right, moving on to our next story. Again, not COVID. American is hospitalized with swine flu after touching infected pigs on a farm in western Pennsylvania. It says Pennsylvania, but I can tell you right now it was in western Pennsylvania. So this is not good. And haven't heard much about swine flu in a while. And it says that this is H1N2, in case you're wondering. There's a lot of different H1s out there, and this one is called H1N2. So, yes, that's not good. It's not something we've talked about here in quite some time. And now taking a look at this. In Australia, this is COVID related. In Australia, almost 1 in 5 Australians are suffering from long COVID study fines. Yes, this is not good at all, and you can see here, it's something that is continuing to rise. Not only in Australia, it's continuing to rise around the world, and we do have another story. Look at this. New data. Long COVID cases surge. This is here in the United States, and all of January has been seeing a big increase in long COVID cases, and that continued well into February, based on census data of those surveyed, and it says they have experienced long COVID symptoms. 17.4% in February stated that they are dealing with long COVID symptoms, so that is not good. Moving on to this now. Speaking of my throat being messed up, hopefully it's not strep throat. Japan is warning about a huge, unexplained spike in deadly strep cases. Yes, this is not good. So strep throat, it is really starting to take off there. It says, as of March 10th, there have been 474 cases of more severe strep. Yeah, this is STSS, which can have a mortality rate of up to 30% according to a health ministry report. So that is not good. I did tweet out this story, so you can read that whole story out on my Twitter page, and I'll make sure this gets to the website. Quick note, the website was down this morning. Last I checked about 20 minutes ago, the site is back up and running, so It's not an issue on my end. It's an issue with the host. Nothing I can really do to fix that when my host goes down. All right, continuing on now. Let's take a look at air quality. Don't have anything to talk about in this day in COVID history. There is one thing, but I think we'll leave that out for today. And taking a look at air quality, yes, you're noticing it's a little worse today in California and in Oregon. You can see there are a few more orange and red sites. And take a look at this in Nebraska, Chicago, Iowa, Illinois. Yeah, there's quite a few places today that are dealing with moderate and sensitive air quality values today. So if you live in those areas, please make sure you have your air purifiers running. Moving on, wanted to check Philadelphia Fire Department today, and we'll take a look again. Nope. Still no update on the Good Friday numbers. It's a holiday weekend, so you would expect to see less data this weekend. Taking a quick look at Montgomery County, you can see here, respiratory emergency. Yes, another respiratory emergency. Quite a few calls. Actually, not that many. 9 right now. And earlier there were more. There was over 10 earlier. Taking a look at Chester County, Pennsylvania. Live look in. And we see here that respiratory difficulty, there is one call for that. Seizures and some other things are going on at this time. Walgreens this week. National positivity rate is 15.1%, which is down 0.4% from last week's number. Tomorrow will be wastewater day, so we're not going to look at any wastewater today. If we do an update tomorrow, it will be wastewater day. I'm thinking we will, but who knows what's going to happen with this voice over the next 24 hours. Taking a look at some hospital bed capacity. Across the United States, 75.9% of all beds are being used. COVID-19 makes up 1.3% of them. Influenza makes up 0.7% of the beds being used. And in the ICU at this time, all patients, 70.9% of ICU beds are being used. COVID-19 makes up 1.3%. Influenza makes up 0.8%. And let's go back to inpatient bed use. Let's take a look at just a couple states. And how about we go out to the West Coast? What is going on in California? I am interested to know. And in California, 78.5% of all beds are being used. 1.2% is for COVID. 0.3% is for influenza. What's the ICU situation there? A little bit more ICU beds being used. 68.1% of all ICU beds are being used. 0.9% for COVID. 0.2% for influenza. And how about we come down now to Minnesota? What's going on there? ICU usage in Minnesota is down a little bit. 75.6% are being used. 1% for COVID, 1.2% for influenza. Inpatient bed usage in Minnesota is at 80.8%. COVID-19 is at 1.2%. And influenza is at 1.2%. And we'll do one more state. How about we come down to Georgia? Inpatient bed usage in Georgia is at 77.4%. COVID-19 is at 1.9% of that. Influenza is at 0.9% of the usage. And ICU usage there. Look at that. It has dropped a little bit. 77.7%. COVID-19 is at 2.3%. Influenza is at 4%. All right, moving on now. As you can see here, the number of red sites for wastewater, it's dropping big time. It's now down to 16. Hopefully we can get that below 10 on the update next week. There are still a few states that have very high or high levels of COVID detected in wastewater. That is New Mexico, Missouri, and let's see, where else? Even Kentucky, it's still coming up as high, but you can see everywhere else is either moderate or low levels or even minimal levels at this time. All right, moving on now, variant proportions. We did get an update on this yesterday, and the latest variant to take over in the United States is still the JN.1 variant at 86%. That is dropping ever so slightly. JN 1.13 is at 10.8. That is an offshoot of the JN.1 variant. JN 1.18 is now at 1.6%. But the 1.13, that's the one that is rising the most at this time. Taking a look at this week's influenza map, and you can see, we'll loop this for you here. Let's go backwards. You can see as the season went on, we peaked at the end of last year. Then there was a second peaking in February. And take a look at this. Levels are continuing to drop in most states at this time. There are still some areas that are above moderate at high. And there is nowhere now that is in the very high category, which is really good to see at this time. All right, taking a look at New Jersey for today. We have to refresh this. Don't know how many hospitals will have reported in New Jersey. Let's see here. Let's check. New Jersey, 65 out of 70, and it'll probably be even less tomorrow. So the current number of hospitalizations, with 5 hospitals missing, is at 250. 10 people are on a ventilator, and 40 people are in the ICU. And discharges at this time, 27 discharges in the state of New Jersey. Skipping over New York State because, let's face it, New York State likely has not updated, and we're going to California now. And in California, new hospital admissions, they're down. COVID deaths are down. The positivity rate for COVID, it is up ever so slightly by 0.4%. Influenza positivity rate is up by 0.2%. And I should add, COVID positivity rate in California is 2.8%, and influenza is 5.3% at this time. LA, things continue to look pretty good in LA. Hospitalizations are dropping. Deaths rose ever so slightly. I don't think that's going to be a long-term thing. Testing, it has leveled off a little bit, which is to be expected. I mean, we can't expect the positivity rate to continue to just drop to 0. I don't think that's going to happen. And at some point, not just LA, but around the country, there will be another wave of COVID. It's just only a matter of time. We don't know when it's going to be, but eventually another wave will come. But the good news is, at this time, COVID, not just in LA, not just in California, across much of the country, is dropping at this time. What we're going to be watching for over the next couple of weeks is a potential spike or rise, actual rise in COVID around the country as a result of Easter. Alrighty, folks, that's all I have for you today. We'll have another pandemic update, maybe again tomorrow. I don't know. All depends on what this voice does. Don't worry, I am going to test again for COVID. I'm going to drink plenty of liquids, and I'm going to try to resolve this. If it doesn't get any better next week, well, you know the deal. I'll be calling my doctor to find out if he can prescribe an antiviral or something to get rid of whatever is going on here in my throat. I will see you all again next time. If you enjoyed this update, hope you did, give it a thumbs up. If you want to see more content like this, or more content when my voice is back to normal, subscribe to my channel down below, share this with anyone you know, and of course, leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Saturday afternoon and a fantastic Easter weekend. Thanks for bearing with me and watching. See you all again next time.